So now we'll discuss a very important comparison that is between a convulsion versus a syncope. Now this is very commonly faced problem in the hospitals. Now see, in convulsions usually the patient loses consciousness and it is almost always for at least more than 5 minutes. Though the patient may also lose the consciousness for around 2 minutes, 3 minutes also, but most of the time patient loses consciousness for at least more than 5 minutes. Whereas for syncope, this is usually very commonly for less than 5 minutes. Most of the time it is very commonly for less than 1 minute. So this is very important differentiating point between convulsion and syncope. The second thing is the event amnesia is very common in convulsion. It means most of the time patient doesn't remember that what actually happened, what happened, who came, who brought the patient to the hospital, to which hospital, how much time it did take to reach the hospital, how much time evolved after getting admitted to the hospital. This is very commonly seen with convulsion, whereas in syncope, most of the time patient gain consciousness very easily. They remember almost everything, that how it happened, what they were doing, who brought them to the hospital, or what exactly they did. So this event amnesia is very commonly present in convulsion, whereas it is very commonly absent in the syncope. The post-ictal confusion is very important sign of confusion of convulsion. The C stands for convulsion. It means very commonly, very often when patient gets convulsion, after that they remain in irritable state. They remain very restless most of the time, or many of the time. They do not recognize the people around. They do not recognize the doctor. They may quarrel with the hospital staff, doctors, or their even relatives also. So this confusional state is very common feature of convulsion, whereas it is not very much seen with syncope. Uh, in convulsion, most of the time, patient do have significant muscle contractions of maybe upper limb or lower limb. So very commonly, their jaw muscles also contract very heavily. So very commonly, they bite their tongue very badly. So we can see a clear-cut tongue bite. So most of the time, the tongue, some portion of the tongue will be swollen on the lateral aspect or in the anterior aspect, and there can be some bleeding also from the tongue. But this tongue bite is very uncommonly seen, or is not a feature of syncope. So whenever tongue bite is there, it is almost always suggestive of convulsion. There are some other things also, that convulsion may occur at any position. Whereas syncope almost always occurs when the patient is standing or walking, or when patient sits from lying down position. So most of the time, syncope is because of the hypotension or orthostatic hypotension, or because of some drugs like diuretics or antihypertensive medicines, or is very commonly can be because of the arrhythmia, for example, atrial fibrillation or ventricular tachycardia or supraventricular tachycardia or ventricular fibrillation, which may disappear to a normal sinus rhythm. But whereas for convergence, it is almost always the brain which is problematic. So the patient may have brain injury, so patient may have stroke, patient may have bleed, patient may have trauma, or patient may have central cortical venous sinus thrombosis. So most of the time, brain is responsible for the conversion, whereas for syncope, it can be dehydration, it can be hypoglycemia, it can be drug effect, or it can be cardiac problem. But brain is usually not a culprit for the syncope. So these were the most important thing. In convulsion, usually recovery may take few minutes. It may take around 10 minutes, 15 minutes, 30 minutes also. Whereas in syncope, most of the time, patient regain their conscious within 1 to 5 minutes. Most of the time, to less than 1 minute. And before getting the syncope, patient may have lightheadedness, which is very commonly seen, or the blurriness of the vision can be a feature of syncope, whereas in convulsion, a aura can be there. So patient may get intense headaches, or patient may get some hallucinations, or patient may feel very uneasy before getting convulsions. Objectively, we can do serum prolactin test. So serum prolactin levels are usually very commonly raised or elevated in convulsions, whereas in syncope, serum prolactin levels may remain normal, or most of the time they are normal. So these were some very interesting things which can help us to differentiate between syncope and convulsion. So for convulsion, usual tests which are required is MRI or CT brain to see any bleed, any tumor, any lesion. Very commonly, EEG, that is electroencephalogram, is very much necessary. And some blood tests like saturation, we have to see through partial pressure of oxygen. We have to see serum sodium. We have to see whether any drugs, whether the patient is on some drugs, or whether there is some poisoning like organophosphorus poisoning. And for syncope, blood pressure remains one of the most important thing. Sugar or BSL remains one of the most important thing. Doing ECG to see whether the patient is atrial fibrillation, ventricular tachycardia, ventricular fibrillation, complete heart block. These things very need to be seen. 2D echo to see the EF, or the ejection fraction of the patient. So for today, this is all, and thank you so much for your